over the next couple of years in my training, kind of two key thoughts kept coming back to me subconsciously. One was that there seemed to be this really exciting opportunity because of the convergence of changes in healthcare and then changes in technology. So I mentioned already, but there was this massive shift in healthcare funding going on in the US and starting to come here. And so there's this huge urgency in the US now to drive better care, lower costs in a scalable way, but how do you really do that? And at the same time, there's this huge emergence in technology with mobile, with connectivity and the internet. And I started wondering, okay, if you start combining these two, could we use people's mobile devices or their desktop computers to better engage them when they're outside the walls of the hospital, then help the healthcare team manage them better, deliver better healthcare, save costs and whatnot. So I'm thinking about some of these things. And the second thought though was, gee, it seems really hard to build stuff inside our healthcare system and make sure it doesn't just stay on a shelf and actually gets out there. And I started to think, well, maybe entrepreneurship is a better vehicle to actually not just build new inventions in healthcare, but actually scale it out and make it a real innovation across the healthcare system. Because the difference between starting a company and starting inside a healthcare organization is that if you're in the healthcare setting, if something stays on the shelf, nothing bad happens to you, nothing bad happens at all, right? You can sit there, you can do your thing. But if you start a company, you are incredibly incentivized to actually scale out your product and get it everywhere, because frankly, if you don't, you are screwed, you're going to go under, right? And so I said, okay, if I'm going to do this, my incentives are going to be aligned to really spread this way to the company. So my last year of training in 2013, I went through this local entrepreneurship program called the Next 36. And there I met my co-founders, Phil, who's an engineer, and Willie, he's a computer science grad, and together we started this company called Seamless MD. And then I got my MD, but then I went full-time in the company that year, and I've been doing it full-time ever since. So what does Seamless MD do? We're on a mission to give every patient the best health outcomes for surgery. And the way we do that at a high level is we provide a patient engagement and clinical intelligence solution that hospitals use to educate, engage, and keep track of their patients as they go through a surgery. So in more simple terms, the way it works is patients and their caregivers get access to our self-management program on their smartphone, their tablet, or computer. So they can access it through a browser, or they can download an app on their app or Android device. And it guides the patient through their pre-surgery and post-surgery care plans in a much more interactive way. So, usually they get things like paper and verbal instructions and fragmented telephone calls. With our experience, they get electronic reminders, they get tasks, they get surveys, video education, they track their progress. And we take all that data and we send it back to the care team at the hospital so they can track patient compliance with their care plan and their progress. They can monitor and catch warning signs of, say, infections earlier, and overall, they can do new things to drive better care. And so we've been on for 3 years now. We've raised about 1.5 million from venture capitalists and angel investors. We've had thousands and thousands of patients use the program for a wide variety of surgeries. Ranging from, at least locally here, ranging from hip and knee surgery at Sunnybrook to, say, lung cancer surgery at Toronto East General. And since last year, we've been live in the US as well, so that's been particularly exciting. Gotten tremendous feedback from providers and patients. So we have hospitals who've shown that they can use our program to reduce surgery cancellations and visits back to the emergency department after surgery. We had patients telling us it's made them feel more connected with their care team. We've even had patients tell us that it's helped them catch things such as blood clots sooner and get treated faster. So lots of terrific feedback there.